and we can't get away from this coronavirus scare. Now, there was some news today that is going to freak some people, another death, more infections, new travel bans, plus warnings from medical officials that they can't actually stop this virus spreading. But before I give you that news, maybe to inspire people not to panic, friends, mates, this is a time when we define what it is to be Australian. Is a real Australian the kind of person that's a panic merchant and selfish? Is it the kind of person who strips our stores of toilet paper as if the entire country has suddenly got the worst case you've ever heard of mass diarrhoea? People who cram months' worth of toilet paper in their car, leaving none for other shoppers. People who get too freaked to think, wait a minute, seriously, what are the chances of us really running out of toilet paper? And the answer to that, by the way, is none.
No, we can reassure you we will not run out of Kleenex toilet paper. As you can see, we have plenty of stock behind us, and our local mill in South Australia are working around the clock in order to meet the demand that we're currently seeing. So we will not run out of Kleenex toilet paper.
Okay, so those scared little selfish rabbits out there, woo, that's one kind of Australian we can be. The other kind is the kind of Australian I thought we always were. Well, around 90 years ago, when Australia was being belted with the Great Depression, cartoonist Stan Cross drew perhaps the most famous cartoon in our history of a bloke laughing as he clings for life to the pants, the sagging pants of the bloke above, who's saying, for God's sake, stop laughing, this is serious. Now, that old spirit of Australia was summed up for me today by one man. And it wasn't one of our health officials, although I agree, they have been fantastic. They've been calm, they've been informative, they seem extremely talented. And it wasn't the Prime Minister either, although I do think he's done quite well here. No, my hero, my true Australian in this moment of crisis is this bloke, flat out, making toilet paper for Australia at its greatest hour of need.
Oh, it's flat out, but, you know, we'll do anything for Australia. These times call for desperate measures, so we're working around the clock, and that's just how it is.
Excellent. So work going well?
Oh, it's going well. Business as usual. It's not easy in there, but we rock up every day and we do our thing, so, yeah, we'll just keep doing what we got to do.
Bloke from Kleenex. What a man! And that, people, is the true Australian, I hope. But I've been delaying. Let's get to that news from today. The second Australian died last night from the coronavirus, 95 years old, a woman in a Sydney nursing home. It apparently caught it from a carer. And the number of cases in Australia is now up to 54, 2 more this evening in Queensland. And at least 7 involve Australians catching the virus from other Australians. And that had the New South Wales Chief Medical Officer warning that we can stop the spread of this coronavirus, but we cannot stop it because of an irony. These symptoms may be so light that people spread it without even knowing they're sick.
The experience overseas is that we are not going to be able to contain this virus, and that's because it's a very mild virus. But you can see that day in, we are working as hard as we can to slow the spread, and we are really slowing down any community spread, and that is to buy time for our health systems to take steps to do all the planning they need to do, as well as to reduce the spread of the virus in the community and its impact.
And the Australian Chief Medical Officer also today had a similar message when he said, our health system is getting ready for a worst case scenario of millions of us potentially getting sick.
We're looking at scenarios from the most benign through to, you know, some millions of people being infected over a period of several weeks. And we think our health system is well prepared to cope with that, but we're making sure, the Prime Minister's been very clear to us that we need to be sure that we plan for every eventuality and build capacity where we think it may be under pressure if we have one of the worst case scenarios.
Yeah. Now that obviously was a very, very, very worst case scenario, so let's not start, but one particular danger is this virus getting into Aboriginal communities in the north.
So in the remote communities we have our Indigenous population who do have a higher health chronic disease burden, and so people who are elderly or who have chronic disease are more at risk of getting severe disease with the COVID-19 infection, and so that's why we're particularly concerned about our remote communities.
And the bad news on that front is that one of the latest cases, ominously, is an infected man who flew from Sydney to Darwin. Luckily, he says he didn't have much contact with people up there, but it's a warning. Now, to slow the spread of the coronavirus, the government today announced further travel restrictions. We've already banned travel from China and from Iran. Now there's a ban on travel from South Korea, where nearly 6,000 people have caught the virus. Plus, people come from Italy will face tougher screening at the airport, including temperature monitoring. And that's because people from Italy have so far brought the virus to at least 35 other countries. That's an astonishing gap in protection. But the Prime Minister says the reason it's not banning travel from Italy, like it's just banned it from South Korea, is that we get 5 times more visitors from South Korea, and that makes screening them all too hard. Now, it all sounds scary, but the Chief Medical Officer said, please, keep calm and carry on.
There is no reason to put a mask on when you're walking around the shops. There's no reason to stop going to football matches or community activities. There is no reason to delude the shelves of lavatory paper in the supermarkets. We should continue our normal activity.
And let me reassure you again, the death rate from this virus outside China still seems to be 1%, maybe lower. Much lower, hopefully. And 99 out of 100 people who get sick outside China get better. And children don't seem to get much affected at all. Plus, if we can slow the spread of this virus, there's a reasonable chance that we may have a vaccine in a year or year and a half. And in the meantime, just wash your hands, warm water, 30 seconds, back and front. Don't touch your nose or mouth. Avoid touching surfaces that have been touched by other people, and carry on. Like Australians and not like headless chooks.